The New Mexico Department of Health Region 5 stated in March 2012 that over 50% of the inmates in the Doña Ana County Detention Center had serious mental health issues that required medication at the time of booking. Chris Barela is the director of the Doña Ana County Detention Center.
Currently, when an officer comes across a person out there that is exhibiting signs of protective custody need, there isn't a facility in Doña Ana County to provide them protective custody, so they have to go to jail.
There are 11 full-time mental health professionals working in the detention center. However, these services can develop a backlog due to the high volume of inmates requiring help. In August, inmate Daniel Leva was found by officers to be hanging by a hook after attempting suicide. He was then taken to an area hospital. It was there where he was declared brain dead. Barela said that the suicide attempt happened after the inmate was cleared to be no longer on a suicide watch. We asked Barela why this inmate with these known behavioral health issues was placed in a room with an object like a hook.
Well, by standard, all cells need to have a method of hanging your towel, method of hanging a sweatshirt or something. The hooks that we're talking about are actually by standard made to give after so much pressure. So, but people can jerry-rig those hooks to hurt themselves.
Barela said that his staff was currently looking into possibly replacing the current types of hooks being used at the jail. Mental health advocates, law enforcement, and Doña Ana County officials are some of those who have been working for years to establish the need for the County Crisis Triage Center. The facility that was completed this summer is to provide a safe and secure place for authorities to take individuals with serious mental health issues so they can receive proper treatment, according to Sylvia Sierra, Director of Health and Human Services.
At this point, we do have a resolution that the Commissioner passed that the main focus will be law enforcement. And depending on how successful we are with the law enforcement drop-off, then we'll consider moving forward with walk-ins.
According to the New Mexico Department of Health, in fiscal year 2011, over half of the $9 million medical budget of the Doña Ana County Detention Center went towards behavioral health services. The New Mexico Department of Health also stated that inmates with serious mental health issues are likely to stay in custody 2 to 3 times longer than others and have a recidivism rate at approximately 80%. According to Chris Barela, once the triage center is open, it will provide jail and hospital diversion for individuals exhibiting the need for protective custody who do not commit serious crimes.
They don't need to go to jail anymore and go through that entire adjudication process. Instead, the officer can move them, bring them over here, and place them under protective custody. They can get the care that they need and hopefully the appropriate referral, and then they can get them back home where they should be, probably.
Doña Ana County is currently looking for a provider to operate the Crisis Triage Center. The facility could become operational as early as next year. For KRWG, I'm Anthony Moreno.